Hi, my name's Dr. Timothy Plank. I'm a family doctor here in Elyria, Ohio, and I wanted to talk briefly or educate a bit about skin conditions. Skin problems are a common reason. Many people show up to family doctor's office, and most of these conditions are usually benign, but on occasion they do indicate a serious problem. The first thing that comes to mind for many people is whether they have a skin cancer, because sometimes, especially with pigmented or colored lesions, there is a risk of serious cancer such as melanoma. And this is a cancer of the pigment cells in the skin, and this can spread to the brain, lungs, and be deadly just like any internal cancer such as lung cancer. So please get especially pigmented lesions evaluated fairly promptly if you're uncertain whether there's been a change or no change. The other two types of skin cancers are squamous cell cancer and basal cell cancer. These are cancers of various layers of the skin, because the skin's made up of various layers, and cells at different levels of the skin can transform into a cancer. These usually are not as severe as a melanoma. Basal cell cancers rarely spread elsewhere in the body, and they can usually be treated locally and don't always require evaluation by dermatologists. Squamous cell cancer is another type of skin cancer that on occasion, depending on its location, can be metastatic or spread elsewhere in the body. It's a good idea not to determine that yourself or decide whether something's benign, because it can lead to serious problems like any other cancer elsewhere in the body. So if you have a skin lesion that has changed size, color, growing, irregular borders, you should have that promptly evaluated by a qualified physician, and this may lead to a biopsy of that condition to prove whether it is or it is not skin cancer. Other common skin conditions include infections such as viral infections such as shingles or chicken pox, fungal infections such as athlete's foot and ringworm, bacterial infections such as impetigo or MRSA, which is a type of staph infection. Some skin conditions indicate an underlying problem within the body. Yellow color skin can indicate something like cirrhosis or liver cancer. Some skin conditions can be an indication of an infestation such as scabies, mites, bug bites, and these can be anywhere on the body, and sometimes these require treatment and sometimes they don't. Probably the most common reason a person comes to the office with a skin condition, or at least what is found out to be, is a type of fungal skin condition, warts, calluses, usually very simple things that are easily treated. Various skin conditions can be seasonal. In the springtime or in the fall, it's very common for the doctor to find a condition such as poison ivy, contact dermatitis. Bottom line, if you're uncertain about a skin lesion, how long it's been there, whether it's growing, changing size, color, etc., you should get that evaluated.